Holland Wilcox acknowledges the traditional custodians of the lands on which this podcast is recorded. We pay our respects to their elders, past and present, and to all First Nations people joining us today.
Hello and welcome to our podcast on health and aged care issues from an international and cross-border perspective. In this series, we'll be chatting with our colleagues from UK law firm Mills and Reeve so that we can bring you both an Australian and UK perspective on topical issues in this sector. Today, we are focusing on healthcare, which includes hospitals and medical and allied health practices. My name is Alison Choi Flanagan, and I'm a partner with national Australian law firm Holland Wilcox, and I co-lead the Health and Care Group. Today, I'm joined by Julian Smith and Jill Mason, who are partners at Mills and Reeve. We'll be discussing key issues when entering into the UK and Australian markets, M&A trends in the healthcare sector, and wider NHS and regulatory developments. Mills and Reeve is a national commercial law firm in England with 7 offices, over 1,300 staff and 171 partners. We have a good relationship with Mills and Reeve, and I'm proud to say that culturally we're aligned. We're very much very down-to-earth lawyers, providing commercial solutions and very approachable in our approach for clients. Jill Mason heads the Mills and Reeve National Health and Care team. She acts for providers, both public and private sector, commissioners, regulators, operators and investors on complex patient care matters. Jill supports clients with a wide variety of fascinating work, including MHA and MCA advice, risk management projects, duty of candour, patient and public engagement, JRs, inquests and NHS CHC. Julian is a corporate finance partner with around 30 years experience and a particular focus on the health and care sector and health tech. He works with clients embarking on major corporate projects, including acquisitions, disposals, joint ventures, and shareholder collaborations. So welcome, Jill and Julian. It's great to have you here with us. First of all, I'd like to sort of ask, what are the key trends that are occurring in the UK and EU at the moment, and where do you see opportunities for Australian businesses?
Morning, Alison, and thank you very much for inviting us to join you on the podcast today. I thought it might be helpful if I just give listeners a bit of a quick overview of the health and care sector in England, and then that'll lead us on nicely to the key trends. So just to give a little bit of context, in 22-23, the Department of Health and Social Care here spent £182 billion on healthcare. And that's used to fund a whole range of services here. And that includes GP services, general practitioners, so our primary care, ambulance, mental health, community and hospital services, which are all commissioned by the NHS. And then we have separately public health services, which are commissioned by our local authorities. And this financial year, that budget is set to increase to £192 billion. And then just to give a bit of international comparison, in 2022, the UK spent about 11.3% GDP on health. So that's just above average for comparable countries. So all this money that's being spent here, those services can be provided either by the NHS, but also by the private and independent sector. So when I say they're commissioned by the NHS, they can be provided by independent sector healthcare bodies. And then to add a little bit of interesting context to that, we've got a new Labour government here who won the general election last month. And one of their priorities is to build an NHS that is fit for the future. And to do that, they want to use the independent sector very much so. And they want to ensure that patients are diagnosed and treated more quickly. And just last year, the independent sector here were responsible, for example, for taking 1.67 million people off NHS waiting lists. And 1 in 5 of the operations and diagnostic tests carried out under the umbrella of the NHS were carried out in the independent sector. So Labour have committed here to sort out the NHS waiting list within 5 years, so not immediately. What's that going to involve? It's going to involve apparently an extra 40,000 appointments a week, and our waiting lists here are currently sitting at 8 million people. So as you can see, there's a huge amount of opportunity for the independent sector. And then separate to all of that, we do still have millions of people each year choosing to use private healthcare, either through insurance policies or paying themselves. So hopefully that gives a little bit of a backdrop. But if you were an independent sector organisation and you were interested in operating over here, what things might you need to have at the top of your list of things to check off? Regulation, I would say would be top of the list, but I need to put a little bit of context around that. So our regulator here is the Care Quality Commission, and they regulate both health and social care in England. And I can't possibly do a podcast without mentioning Taylor Swift. In the words of Taylor Swift, there's a lot going on at the moment in the context of CQC. So what are those? There's 3 things just to be aware of if you were thinking of entering this market. Firstly, there are changes coming and happening at the minute to the way the CQC regulate. So they've created something called a new single assessment framework that they started to roll out last year. And that's all about delivering dynamic regulation. And it's all about being data-led and looking at people's experiences, looking at care integration, and most importantly, the culture of safety through learning. So that's a new change to how regulation's being done. But that's not the biggest news here. The biggest news here is a change to personnel. The chief executive suddenly stepped down last month, slightly unexpectedly. There's been a lot of criticism of CQC here recently. And the third thing to flag, which is relevant perhaps to him stepping down, is a review of the whole CQC's function here. And that review has been commissioned to look into the effectiveness of CQC, and it's looking at things like whether their ratings are properly rewarding and incentivizing the improvement of care, whether patient voices are properly being taken into account, and whether the CQC has the leadership and staffing that it needs. So just be aware that if you're coming into this landscape, there's a lot of turmoil in the regulatory side of things. And interestingly, just after the chief exec left, the CQC themselves admitted that they were failing to keep patients safe and that they were losing the confidence of ministers. So what got leaked here was an internal problem statement, which had been prepared by the interim chief exec. And she said that stakeholders and the Department of Health and Social Care are losing confidence in our ability to deliver our purpose. So that has slightly put the cat amongst the pigeons. And then hot off the presses last week, the same interim chief exec actually issued an apology to providers here in both the public and the independent sector. And she says, we've got things wrong in the implementation of our new regulatory approach. And the changes we delivered so far aren't what we promised. It's made things more difficult than they should be, and we're not where we want to be, and we're determined to put it right. So again, if you're coming into the market, bear all that in mind, that there's change happening underneath in terms of regulation. So that's a quick gallop through the Care Quality Commission. Other things that independent sector providers coming into the market might be interested to know about is change in the world of procurement as well. So there's something here called the provider selection regime, which just came into force at the start of this year. And as you know, we've left the EU. So Brexit, as it was called, presented the country with an opportunity to move away from various requirements of the EU public procurement law. So this new provider selection regime allows for services to be procured here without a fully competitive process being run in certain circumstances. So all NHS healthcare services must be procured using this regime now. So that's whether they're being procured from a public sector or an independent sector provider. And that will cover things like primary care, like ophthalmology, cardiology, rehab, hospitals, and related services. And there's now going to be 5 different routes here to awarding contracts. So again, something else to bear in mind. But you've probably heard enough from me at the minute. You might want to move on to Julian, who can tell you some other key trends.
Julian?
Thank you, Alison. And again, thank you for having us on this podcast. Yeah, my area is corporate finance and mergers and acquisitions, and I focus along with my team purely on the health and care sector here in the UK. And we have seen quite an interesting trend, because during the immediate post-COVID years, there was a very buoyant market, and that reflected not only a wider global uptick in M&A in all sectors, but particularly in health and care, where I think people realized the penny really dropped to healthcare is obviously vital, and it continues and is even more important and existential for us during periods of pandemic and global crisis. So we saw a lot of activity in those post-COVID years, and the market was very active. And then things almost hit the buffers last year in 2023, where a whole range of things came to the fore. It was very sluggish, and M&A often is quite characterized by herd mentality. And we saw that just suddenly the deals slowed down a lot, and they stopped happening, and people didn't want to put things out and go to market. That was because of a number of significant changes. Obviously, we have the high interest rates, and in the UK, whilst you wouldn't say that it's dominated by private equity activity, mergers and acquisition pricing and confidence were definitely hit by the high interest rates, and therefore private equity not being able to reach the increasing seller price expectations that they were. Of course, there was the international climate to international wars. And on top of that, in the UK, we had a conservative government in some disarray, a lot of infighting, and all of that taken together just meant that confidence was low. Now we still did deals, and there is definitely an improvement in the confidence levels now, taking each of those things in turn. Interest rates are clearly on the way down. It's sad to say, but we are becoming more accustomed with the fact of international wars being fought. And we now have a Labour government which is at the very least intent on focusing on the issues and policy, and hasn't got the infighting and scandals that beset the Conservatives. So more of a focus on the health sector. And as Jill said, for private companies, or as we call them in the UK, in the independent sector, that stability is really important. Unfortunately, the Labour government didn't, as it has in the past, distance itself from the independent sector. On the contrary, it's embraced the independent sector and the potential that it has to, and the role that it has been playing to significantly help with the growing waiting list crisis in the NHS. And there's a recognition that independent sector did a lot during the COVID period to help deal with the serious issues that the NHS had at that point. So what have we been seeing in terms of the different kinds of M&A? And some of it has been driven by, and I'm conscious of your likely audience, Alison, but hospital groups diversifying. We've never seen a lot of acquiring hospital activity. We have acted for US hospital groups acquiring UK hospital groups, but really over the last few years, we've seen a real uptick in hospital groups diversifying, acquiring primary care, oncology, MSK services. In fact, we acted on a transaction where one of the largest hospital groups, Spire, acquired Vita, an MSK business. We've also seen and are seeing an increased focus on what we call in the market outsourced services. As Jill said, a lot of the hundred, and I haven't got the exact figure at my fingertips, but it's 180 billion pounds roughly of spend that the NHS has. A lot of that is spent with the private sector, with the independent sector, providing speech marks, NHS services, close speech marks, to patients of the NHS, and that's nothing new. We acted on some of the largest billion-pound transactions where our clients were providing those services to the NHS under long-term contracts. But we're seeing a return to that because the NHS is cash strapped, and there's a realization that a lot of the things that are required for healthcare require capital investment. So there's a diversification of the technologies required to provide healthcare services. So, for example, it can be very niche. We acted on the sale of an autism diagnostic business to a private equity-backed platform called OneBright last year. So that was one of the smaller transactions in the sector, but nevertheless an example of the sort of thing that's going on. The other thing which I have to mention, because it's historically been quite an important part of the healthcare sector, is elderly care and what we call social care, so your care homes. That's been impacted by public funding because a lot of it is publicly funded by local authorities, and that allied with higher cost of living, which impacts the day-to-day P&L of care home businesses, has made it a very difficult environment. And we've actually seen some distressed M&A. I've been leading a team working with Four Seasons, one of the larger healthcare groups, on a large number of care home sales. And the other thing that's impacting or has a potential to impact the sector, as Jill mentioned, is the regulatory environment. And some have said, well, look, the CQC, as Jill said, is under some pressure at the moment, and there is a significant possibility of a change there. But most of the policy analysts and people in the know feel that a change would not be a dramatic one, because that would be unhelpful. It just needs to work better, and that suits everybody. So yeah, that's the sort of the helicopter view of the sector, Alison.
It's interesting to see so many synergies between what's happening in the UK and what's happening in Australia. So like you, we have a very long waiting list for some of our public hospitals. But in addition to that, because of the cost of living is increasing in Australia significantly in terms of, for example, rental or buying real property, a lot of the population is opting out of private health insurance or reducing their private health insurance level from gold to silver or silver to bronze. We have truly a public-private system in Australia. And arising from that, a number of private hospitals have announced that they're closing their private maternity wings. So that's occurring. And we're seeing, like you, in our aged care sector, because we had a Royal Commission, because there's higher regulatory costs, we've got an exposure draft for new Aged Care Act. We're seeing a lot of consolidation in the aged care sector. So we're working a lot of M&A, some distressed M&A in the aged care sector. There's a lot of opportunity there. And what we're finding with the public sector is that they really are tightening the belt. So previously, there are a lot of consultants out there with particularly the state public sector, and they've reduced the use of consultants. And what they're looking for is cost savings and efficiencies. And one of the things that they're really looking at is the use of technology to save costs. So some of the technology they're looking at, including AI solutions, is about efficiencies in the back office, like billing, or, we've got a client that they have a software program, as you know, with funding, it's activity-based. And so everything's coded to attract the funding. And currently there's human beings that code the medical coding to do for the reimbursement, and the client has a software program that does it instead of humans. So there's certainly, when we've been talking to state government in Australia, they are looking for efficiencies because they are cash strapped like you. Do you want to talk about some of the follow-on tech consequences in the UK? What's happening there?
Yeah, absolutely. We have one of the largest tech sector teams in the UK, and a significant part of that it focuses on the health tech part of the market. Health tech's really exciting, and I know we've talked about this before, Alison, because it is really the dawning of a new era in terms of how healthcare services can be delivered. I know we've all been saying that for quite a while, and it's taking a little bit of time to come to fruition. But again, the pandemic, despite the horrors of that, also brought some silver linings, and one of them was the realization that you can achieve so much more with health tech. The market size globally is reports vary hugely, but on average, people are saying it's about $200 billion US as of a couple of years ago. And the estimated growth is around 15 to 25%, which is staggering growth. If you try and think of any sector that has those sort of fundamentals, you have to sit up and take notice and think about what impact that is going to have on your business, and are you spending sufficient time horizon scanning at what you need to do to keep your business competitive, and are there new markets that just didn't exist? I mean, think back to the days when there weren't coffee shops on every corner of major cities, and then somebody started making a lot of money out of that. Well, I think we're sort of at that point now where everybody needs to be very mindful of this. Before I was a healthcare lawyer, I was a tech lawyer, and that was around the turn of the century when those old enough will remember quite clearly the dot-com bubble burst. The problem is that there are a lot of small tech companies out there, and most will fail. However, the ones that succeed, and there will be an awful lot of them, will be extremely successful. We've seen some particular areas where health tech is of significant interest, and at the front of those has to be women's health, femtech. It shows all the hallmarks of an area that's been neglected for all the wrong reasons. And without laboring the point, I was talking to the CEO of a femtech business recently, who, somewhat to my surprise, because I thought things had changed more, but talked about the despair of talking to men in pinstripe suits about her health tech business, which had some AI and a portal which enabled women to manage menopause symptoms, and it just wasn't really capturing their attention. It was like a dragon's den of people that were deaf. So there is huge opportunity there, and for those that understand or are willing to understand the market, a lot of potential to make a difference. But and financially, it's an area that's been historically underinvested. I think there will be exponential growth in health tech, but in the medium to long term, and in some cases in the short term. Some of the characteristics of the market in the UK are that there are still a lot of early stage, well, not still, there always will be a lot of early stage startups, but that's where most of the activity is. So the funding that we're involved in, we see around the market, tends to be your early stage businesses, so between 1 and 10 million pounds. There are 10 new startups in the UK every day. As I say, I think most will fail, but even if only 3% succeeded, you've got 100 successful new health tech businesses with markets, revenue, and profit every year. A lot of them are obviously life sciences based, but there are healthcare services, health tech businesses out there, for example, supplying access to medical experts, online platforms that provide services. We've been involved in a lot of digital health platforms. We haven't yet noticed a big wave of traditional healthcare companies acquiring those businesses, and that's probably because of where they are in their life cycle. But as more of them become mature and more of them start being sensible bolt-ons or defense mechanisms for healthcare businesses, I think that will change.
Yeah, that's really interesting. We get quite a lot of inquiries, and we've been advising a number of startup companies that are looking to start up e-health solutions in Australia. So online health solutions using video or telephone. And they have been quite targeted. So one of them was the Femtech. So they did want to provide a wellness solution for women experiencing menopause, not only clinical solutions, but also holistic solutions, complementary medicines, and also mental health. There have been clients that want to provide mental health services online. And there's been a lot of clients that are trying to provide holistic healthcare services as well online. So, and, we quite often have to advise on, electronic prescribing, whether that can be done as part of the service, and also what we call protected titles. So, for example, if you're advertising in Australia, a medical practitioner, they have to be registered in Australia. So the Australian Medical Board considers that the service is provided at the location of the patient. So if you've got an online service that's providing medical services to patients in Australia, then the medical practitioner online has to be registered in Australia. So that's some of the issues that we're dealing with. I think that I think COVID-19 opened the world in terms of telemedicine, and it's the norm now, which is great, because it provides access to people who can't necessarily travel, whether they're elderly or disabled. So there's lots of opportunities with that. I think, I agree with you. In Australia, we had a lot of interest during COVID-19 for investment in healthcare businesses. That has reduced somewhat. Australia is a very desirable jurisdiction because our government has R&D tax incentives, and we've got a very good reputation in terms of our healthcare. So that sort of brought some investment into Australia. Certainly we help, in my practice, we help a lot of international companies come into Australia to invest in that area. The things that they have to consider is, like you said, understanding the regulatory requirement when they come in, and also understanding the reimbursement, how they're going to provide that service, who's going to pay, the government or private sector. And with us, if it's health tech, TGA, which is the equivalent to FDA requirements, they need to understand that coming in, and also corporate requirements. For example, Australian proprietary companies have to have at least one Australian resident director. Do you have any hints for companies coming into UK, sort of some minimum requirements that they should understand going in?
Yes, as Jill was saying, our main regulator is the CQC. So for healthcare services companies, that is absolutely the key area of regulation, and we're advising regularly on that. We have a team of lawyers who really do almost nothing but CQC-based advice for traditional healthcare businesses, but also health techs who need to understand whether their services are regulated or not. And then there's a raft of regulation for the more life sciences based businesses as well. So it's a reasonably developed and well structured regulatory regime. And I would say that's probably the key area, unless Jill has got any other thoughts on that.
Yeah, certainly it's our distinguishing feature, because we often work with some of the Magic Circle firms in London who come to us for the regulatory advice on large transactions, because as Julian says, we have a highly specialist team who that's what they do day in, day out. So that's often the most important thing to understand. And then for startup companies, our tech lawyers have a product called Launchpad, which tries to help them understand what they would need to come into the market in terms of what terms and conditions might look like, and so on and so forth. So that's, we too try to be vaguely innovative and tech orientated to reflect the ingenuity of our clients too.
In Australia, we have Foreign Investment Review Board for overseas investment in Australia that meets some requirements. Do you have the equivalent in the UK?
No, I don't think so. It's not something that we've encountered. So I think the UK is quite a business friendly environment. So yeah, the regulatory burden outside the specific healthcare sector and the CQC is fairly benign.
That's interesting to know. So do you have any closing comments about or tips for our clients coming into the UK?
Well, I mean, what we've just discussed and the reflections you've made on what we've said, Alison, just show that it's quite similar but different. It's exciting times, it's changing times, and as Julian saying, there's a huge growth potential here. So, watch this space, and it'd be interesting if we revisited this conversation in 12 or 18 months' time, what we might all be saying in terms of the growth. But I think it's a really positive environment here in the UK.
A lot of large healthcare businesses have entered the UK over the last 10 years, and we've seen a range of different experiences. The ones that have succeeded have been very clear on whether they are servicing payers in the PMI side of the health sector, or whether they're aiming to earn revenue from the NHS, or if it's a mix of the two, how they do that. We have seen some quite high profile failures as well, and that's partly where, in my experience, the incoming investor from abroad hasn't fully understood the intricacies of the NHS, because it's not straightforward. You do need to understand it and have advisors who are health sector specialists, and that you have people on the ground who are going to be able to untangle some of the complexity of the UK system. It's a huge market, but it does have complexity, and you can't think of the NHS as a single monolithic organization. We have a lot of the work that we do actually is contracting between NHS organizations, and dare I say it, situations where those organizations don't agree with each other. So the NHS is a complex organism, and yes, being clear about what it is that you are intending to do in the UK and understanding the environment is absolutely critical.
Thank you, Jill and Julian, for that really insightful discussion. Thanks everyone for visiting today. As always, please get in touch with us if you've got any questions. You can find our details on the Holland Wilcox or Mills and Reeve websites, or connect with us on LinkedIn. If you've enjoyed today's episode, then please rate, review, or follow our podcast wherever you get your podcasts. Thank you for joining us.
This podcast is not legal advice and should not be relied upon as such. You should always obtain legal advice about your specific circumstances.